Welcome to Med Madness, the podcast where we dive deep into the fascinating world of medicine. Today we are exploring a critical topic, myocardial infarction, commonly known as a heart attack. This condition is of utmost importance for medical students and professionals alike, as it remains one of the leading causes of morbidity and mortality worldwide. In this episode, we will cover what myocardial infarction is, its causes and risk factors, pathophysiology, symptoms, diagnosis, management, complications, and even walk through a real-world case study. Let's get started. Myocardial infarction, MI, occurs when blood flow to a part of the heart muscle is blocked for a long enough time that part of the heart muscle is damaged or dies. This condition is most commonly caused by the blockage of a coronary artery due to a buildup of plaque, a condition known as atherosclerosis. Common causes and risk factors include high blood pressure, high cholesterol levels, smoking, diabetes, obesity, sedentary lifestyle, and a family history of heart disease. When a coronary artery becomes blocked, the blood supply to the heart muscle is interrupted. This lack of oxygen-rich blood causes ischemia and ultimately the death of myocardial cells. The severity of the infarction depends on the location and duration of the blockage. For example, inferior wall MI typically involves the right ventricle, leading to complications such as bradycardia and hypertension due to ischemic disruption of the sinoatrial and/or atrioventricular nodes. Common symptoms of myocardial infarction include severe pressure-like chest pain, often radiating to the left arm, neck, or jaw, shortness of breath, nausea and vomiting, diaphoresis or sweating, fatigue and weakness, and lightheadedness or sudden dizziness. Patients with MI typically present with sudden onset of these symptoms. However, some may experience atypical presentations, especially women, elderly patients, and those with diabetes. In cases of inferior wall MI, patients may exhibit symptoms like jugular venous distension and clear lungs on auscultation due to the involvement of the right ventricle. Next, let's discuss the diagnostic methods. Electrocardiogram, or ECG, is essential for detecting ST segment elevation, which indicates myocardial infarction. Specific leads can help localize the infarct, such as ST segment elevation in leads 2, 3, and AVF indicating inferior wall MI. Blood tests revealing elevated levels of cardiac biomarkers, such as troponin, confirm myocardial injury. Imaging techniques like echocardiography and coronary angiography help visualize the extent of heart damage and identify blockages. Important clinical tests include ECG to detect electrical changes in the heart, cardiac biomarkers to measure proteins released by damaged heart muscle, echocardiography to assess heart function and structure, and coronary angiography to identify and locate blockages in the coronary arteries. Now, let's move on to management and treatment. Treatment options for myocardial infarction include both medical and surgical interventions. Medical interventions involve medications such as aspirin and other antiplatelet agents to prevent further clotting, beta blockers to reduce heart workload, ACE inhibitors to manage blood pressure and prevent heart remodeling, and statins to lower cholesterol levels. Oxygen therapy is provided for patients with hypoxia, and pain relief is typically managed with morphine. Surgical interventions include percutaneous coronary intervention, PCI, often referred to as angioplasty, which involves using a balloon to open the blocked artery and placing a stent to keep it open, and coronary artery bypass grafting, CABG, a surgery that improves blood flow to the heart by using arteries or veins from other parts of the body to bypass blocked coronary arteries. Next, let's discuss complications and preventive measures. Complications of myocardial infarction include heart failure, arrhythmias, recurrent myocardial infarction, and mechanical complications like ventricular aneurysm and septal rupture. Specific complications such as papillary muscle rupture, interventricular septum rupture, and free wall rupture can occur acutely or within a few days post-MI. Long-term complications include left ventricular aneurysm, which can lead to progressive heart failure, angina, and ventricular arrhythmias. Preventive measures include lifestyle modifications such as quitting smoking, adopting a healthy diet, regular physical activity, and managing stress. Medical management post-MI includes dual antiplatelet therapy, beta blockers, ACE inhibitors, and high-intensity statins. Next, let's consider a case study to illustrate a real-world example. A 60-year-old man with a history of hypertension and diabetes presents with severe chest pain radiating to his left arm, shortness of breath, and profuse sweating. ECG shows ST segment elevation in leads 2, 3, and AVF consistent with an inferior wall myocardial infarction. Blood tests reveal elevated troponin levels. Right-sided ECG confirms RV involvement with ST segment elevation in V4R. The patient was immediately given aspirin and taken to the catheterization lab for a PCI, where a stent was placed in the occluded right coronary artery. Post-procedure, he was started on a beta blocker, ACE inhibitor, and a high-dose statin IV fluids were administered to manage RVMI-induced hypertension. The patient recovered well and was discharged with instructions on medication adherence and lifestyle modifications to prevent future cardiac events. Follow-up care included monitoring for potential complications such as left ventricular aneurysm or recurrent MI. To summarize, understanding myocardial infarction is crucial for early diagnosis and effective management. Recognizing the symptoms, utilizing appropriate diagnostic tools, and implementing timely treatment can save lives. Remember, early intervention and lifestyle changes play a significant role in preventing and managing myocardial infarction. We encourage our listeners to engage with the pre- and post-podcast quizzes to test their understanding and reinforce their learning. Thank you for listening to this episode of Med Madness. Stay tuned for more insightful discussions on essential medical topics.